Hmm, running away wouldn't help me get far away from this problem. No one can understand what I'm going through, no matter what I say. Maybe I should just.
Hey, how are you?
I'm good, you.
I'm good too. Why are you lying?
You know.
Wanna come over?
Nah, I think I'm good.
You know I'm here if you need anything, right? I trust that you won't hurt yourself.
Depression is painful. What you just saw was a skit giving you a gif about what depression is really like. Ava was suffering from depression and her close friend Ivy was aware about it.
Depression is a feeling of despondency or dejection. In other words, depression means sorrow, unhappiness, sadness, and so on. Depression is felt like being trapped in your sorrows or sadness, unable to pierce through the bubble, giving giving woe, but it feels like no one can hear your screams for help. People will suffer from mood swings, get easily angered, and lack motivation to do any work. Causes of depression. There are many reasons to why a person may fall into depression. Some of them are abuse, genetics, and substance abuse. When a person may suffer from depression, they usually face the following: self harm, isolation, insomnia, hypersomnia, changes in diet, low hygiene, low self esteem, and possibly irritability.
Oh my god, my laugh sounds so ugly. It's so loud and oh my god, my face must have looked so ugly. Hey, can you pass me that Coke? Oh, sure. Why am I such an idiot? Such a fool? Why? Why won't it stop beating? I can't, I am gonna faint.
What you just saw was a small clip showing you how people with anxiety feel and think. Anxiety is a common word people use, but what does it really mean to have anxiety?
Anxiety is something distressing, but it is completely a normal part of our life. However, when the presentation of anxiety meets a certain criteria, such as generalized anxiety disorder, it becomes a disorder. People who suffer from anxiety feel overwhelmed by their thoughts and have a constant feeling like they're on edge, and they usually tend to overthink. Anxiety can be defined as a future-oriented concern that may lead people to avoid situations that triggers or worsens their distress. Signs of depression may be chronic headaches, excessive urge to urinate, muscle cramps, trust issues, and possibly nail biting. A few causes to why anxiety can occur are as follows: overthinking, low self esteem, or even pessimistic thinking, and so on. Now that we have looked at what depression and anxiety are, let's take a look at how they affect different countries. Developed country, US. Causes: there are many Americans resist treatments because they believe depression and anxiety isn't serious and they can treat it themselves, or that it is personal weakness rather than serious medical illness. Poor nutrition. Facilities. The American Psychiatrists Association suggests that a combination of both antidepressants and psychological counseling is on average more effective.
Developing country, China. Causes: those suffering from depression in China find it difficult to come forward, and those around them find it difficult to recognize it. In China, there is still a strong feeling of disapproval regarding mental health issues, with many barriers to receiving treatment or support. Facilities. China's first mental health law came into effect in 2013, aimed at safeguarding the interests of people with mental health disorders.
National country India. Causes: the professional medical workforce is severely scarce in India. Lower income places in India are more prone to depression and anxiety because the population is growing and more people are living to the age when depression and anxiety most commonly occur. Facilities. In 2016, the government appointed psychiatrists who wrote more than 9.4 million new prescriptions for antidepressants and anti-anxiety drugs. This has increased by 12% from 8.4 million in 2015.
Underdeveloped country Afghanistan. Causes. Number 1. Many people in Afghanistan still don't recognize depression as an ailment that can be treated and controlled. Number 2. Poverty. Facilities. The Ministry of Public Health has recently trained over 700 professional psychological counselors and 101 specialized mental health doctors, including some from the country Afghanistan.
So now, what can be done to minimize depression and or anxiety? Get in a routine, talk to a professional, meditate, practice deep breathing, sleep, don't take caffeine. So what will happen if this isn't controlled? The economy will go down. Depressed anxiety patients may pass it on to their children. Suicide attempts and death toll would be high. There would be health issues, dependence on medication. Being depressed or having anxiety might become a trend.
In conclusion, if you recognize any of these symptoms to be within you or a close one, we recommend you to refrain from self-diagnosis and seek professional help. Your mental health is just as important as your physical health, therefore it should be your priority.